Hello, this is M09. My project title is Development and Evaluation of Topical Hydrogel of Mixed Polymeric Micelles for Delivery of Quercetin in Psoriasis Treatment. So as we all know, psoriasis is autoimmune disease in which the skin multiplies at a faster rate, which is 10 times faster than the normal skin turnover. The conventional therapies have few drawbacks, such as it requires higher frequency to apply, then it has a poor skin permeation, hence the patient compliance is very less. Here I have tried to use quercetin to treat psoriasis, as it is a well-known anti-inflammatory drug, but as it is a BCS class 4 drug, it requires some carrier system to load it. So here I have used mixed polymeric micelles by using chloronic F68 and F127. So if here you can see, these are the polymeric strands of both chloronic F127 and F68, and the black dots are the hydrophobic drug, that is quercetin. So once it gets assembled into the aqueous environment, the hydrophobic core will entrap our hydrophobic drug, that is quercetin. And why we are using these two polymers, as F127 has more hydrophobic ends, so it will help in trapping quercetin very well, whereas F68 has more hydrophilic tails, which will help to stabilize our micelles into aqueous environment. These are the advantages and disadvantages of micellar hydrogel. So the main aim of this study is to formulate, optimize and characterize quercetin loaded mixed polymeric micellar hydrogel for treatment of psoriasis, and these are the objectives. So before going into the main methodology part, I characterized the drug by using FTIR, DSC and performed some pre-formulation studies to know the solubility of the quercetin in different solvents. So coming to the main part, that is our methodology. So here I have used solvent evaporation method, in which our drug was dissolved into the organic phase, that was ethanol, and the polymers into the water. Organic phase was dropwisely added into the aqueous phase under the constant stirring at 1000 rpm on magnetic stirrer for 4 to 5 hours. After that, our micellar dispersion was ready, in which the quercetin was entrapped. The freshly micellar dispersion was then transformed into the hydrogel. So to make the hydrogel, we had added the hydrogel base into the freshly prepared micellar dispersion. So like that, our micellar hydrogel was prepared. To go ahead, I did preliminary trials of quercetin loaded polymeric mixed micellar. So from the literature, I got that concentration of polymers ranges from 1 to 10%. So randomly I took initial 1% level and maximum 10% level, and I took the intermediate points as 2.55 and 7.5%. The particle size and entrapment are as shown in the table. So from this table, the 5% batch showed a good results in terms of particle size and entrapment. So for the fine tuning and the optimization further, I had taken only 5% batch with all possible ratios of both the polymers, that is F68 and F127, starting from 10:90 to 90:10. So here we can see that at 5% 70:30 batch, we are getting very small particle size and higher entrapment. So this batch was optimized for further formulation. This is the characterization of quercetin loaded polymeric mixed micelles. So the first graph is the particle size, second graph is the zeta potential, and third one is the TEM image. In this, our micelle is showing a spherical uniform structure with the size of 100 nanometers. Now for transforming this dispersion into hydrogel, we had taken placebo batches of hydrogel. So in this, I had used HPMC K15 grade as a hydrogel base. So I had tried from 1% to 6% as per the literature. Then I had measured the spreadability coefficient, and for the topical hydrogels, the spreadability coefficient was between 10 to 12 gram centimeter. The second hydrogel base was hyaluronic acid in the concentration of 0.1%, same as our API. Now we had formulated our micellar hydrogel and the conventional hydrogel. In the conventional hydrogel, we are not adding any nano carrier for the quercetin. Here we are directly using quercetin solution into the hydrogel. So this is the table, and we again did the characterization of quercetin loaded micellar hydrogel. After that, we had performed in vitro release study in which our micellar hydrogel showed a good results than the conventional hydrogel. After that, we had performed the permeation studies using goat ear skin on the modified France diffusion cell. The drug release in the 24 hours of the quercetin micellar hydrogel was 65.88 with the flux value of 1.89 microgram per centimeter square per hour, and the permeability coefficient was 0.316 centimeter per hour. After that, we did the head cap irritation study to check the irritation potential of the formulation, but none of the groups shown the irritancy in the head cap. Then we checked the activity of our formulation in the animals. So here we had used imiquimod induced animal model. So the groups were normal control, disease control, placebo and treatment. So in 4 groups we had examined the arrhythmia, scaling, back thickness to calculate the psoriasis activity severity index. Then we had measured the spleen weight and did the histopathological examination. So in all these tests, our treatment group showed very similar results to the normal control group. I would like to conclude this. Polymeric mixed micellar hydrogel showed a good anti-inflammatory properties. So as a novel formulation, it has the potential to offer solubility for hydrophobic drugs and to improve the drug release. So it can act as a platform technology to increase the solubility of hydrophobic drugs. Further, it is an effective alternative to conventional gels available for treating psoriasis. As it has no lipids in it, it is a non-occlusive, so it is non-greasy. Also, the frequency of application is once or twice per day depending upon the severity of the psoriasis. Hence, the patient compliance is improved. Thank you.